Hello and welcome to this VPAL signature event. Harvard Speaks on Climate Change, Climate and Health, brought to you by Harvard's Office of the Vice Provost for Advances in Learning and the Salata Institute for Climate and Sustainability, in partnership with the Harvard Alumni Association. For tonight's event, Professor Kari Nadeau will delve into the critical intersection of climate and health. Her insight will shed light on the significance of this relationship, especially as we approach COP28, where the topic of health is being addressed for the first time. Professor and Vice Provost for Climate and Sustainability, Jim Stock, will host. Without further ado, Jim, the virtual floor is yours.
Thanks so much, and good afternoon. Welcome to this edition of Harvard Speaks on Climate Change. I'm Jim Stock, Vice Provost for Climate and Sustainability at Harvard and Director of the Salata Institute for Climate and Sustainability. I'm an economist, and my academic appointments are in the economics department and at the Kennedy School. A core objective of the Salata Institute is to drive impactful research by Harvard faculty and students on climate change, sustainability, and the energy transition. To that end, the Institute supports cross-school research on climate and sustainability topics with a focus on impacts at scale. Harvard has many highly accomplished faculty members across its schools engaged in research and thinking on the frontiers of tackling climate change problems. This series, Harvard Speaks on Climate Change, provides the broad Harvard community an opportunity to learn about their work. We take you on a virtual tour of the research and engagement being done here on climate and sustainability. Each hour will focus on a specific topic featuring one or two faculty members. Today, the topic is at the intersection of climate and health. As the climate warms, extreme weather events such as heat waves, wildfires, droughts, and floods are becoming increasingly severe and prevalent. Unfortunately, the severity of these events will only get worse until we stabilize and perhaps reduce the concentrations of greenhouse gases in the atmosphere. We currently have experienced about 1.2 degrees Celsius of warming, and currently it appears that we're on track to perhaps double that to somewhere in the range of 2 to 2.5 degrees of warming. If we do reach those levels, we can expect weather extremes and their concomitant health impacts to be much worse than they are today. This afternoon, we are fortunate to have a guest who has expertise both in assessing the impacts of certain climate-driven events and in thinking through ways to reduce those impacts. Dr. Kari Nadeau is the chair of Department of Environmental Health at the Harvard Chan School of Public Health and John Rock Professor of Climate and Population Studies. Her clinical practice is on allergy, asthma, and immunology in children and adults. She has published over 400 papers, many in the field of climate change and health. For more than 30 years, she has devoted herself to understanding how environmental and genetic factors affect the risk of developing allergies and asthma, especially wildfire-induced air pollution. Among many other positions, Kari was appointed as a member of the U.S. Wildfire Commission in 2022. Here at Harvard, she serves on the university-wide Standing Committee on Climate Education. Kari will speak for about 25 or 30 minutes, then we'll turn to open discussion. I will select or combine audience questions from the Q&A stream and ask them of Kari. So with that, Kari, let me turn this over to you.
Thank you so much. It's a pleasure to be here, and I very much value all of the alumni and associates on the video tonight, and thank you for your invitation, Jim, to this wonderful conference. I'll share my slides. Importantly is that I know many of you probably had some visions of smoke in the air this summer, and this is a picture of someone's trachea or airway with the wildfire smoke inside them, and they were hundreds of miles away from the actual point of wildfire. So I just want to really focus today on facing the climate change issues in climate and health, but importantly, with that facing, look at solutions. And those solutions are very important. They're urgent to be able to quantify. And if we can't understand that, I think that we need to understand and be curious even more these situations, like in New York City this summer with wildfire smoke, in this picture you see here, that orange sky, unfortunately, this was, again, hundreds of miles away from the wildfire, and you're seeing some of the unfortunate events in the sky, but that also affected health. Not only health in terms of physiology, but also mental health. You can see here after the fires in Hawaii, this was a woman that literally was reaching into her piggy bank here because of the economics of the situation being so drastic. But in that, as Jim was saying, we have seen about a 1.2 degrees centigrade rise in temperature so far. And when you look at across the many decades that are positioned here in the x-axis of this graph, you can see that there's been an increase in certain events, and that includes many extreme weather events, and those are colored differentially here. Importantly, on the y-axis is the number of events, and the y-axis over on the right is the cost in billions. And you can see over time there's been an increase in that cost. Over the past decade, it's cost about $1.5 trillion. So those costs are real in human life as well as to our economy. And the IPCC report in 2022 mentioned that we were on red alert. And so I think for people like myself doing work in climate change and with the Salata Institute's support of this important effort at Harvard, it couldn't be more timely to be able to have discussions like these with the alumni and through VPO. So focusing my discussion today with you on climate change and human health, there are many different areas in which climate change, which has been affecting our planet for decades, has been increasing the chances of health risks over time, both on the acute as well as the chronic side of healthcare. And I'll be focusing today mostly on air pollution, as well as asthma and inflammation or increased immune activity. And in that, I'll talk about air pollution, how we can look at solutions, and then extreme heat and how we can look at solutions for extreme heat. But there are also impacts of climate change with drought, water supply, nutrition issues, environmental degradation, insecurities, conflicts, displacement of individuals leading to post-traumatic stress disorder, mental health. We also have issues around the inequitable distribution and inequitable exposures of certain individuals to environmental hazards, and that includes climate change. So thinking about health inequities and loss of life and also vulnerable populations is important as we think about how climate change is affecting health. Specifically, vector-borne diseases are on the rise. If any of you have looked at that in the news, there have been a lot of conditions that we used to think were quote unquote south of the border, and they are now migrating up in this area in the US as well as in New England. We need to think about this globally as well and track it better. I'm happy to answer any questions that you might have about that. Food systems are impacted, and severe weather, of course, can lead to loss and damages and fatalities, as well as water quality impacts with algal blooms, campylobacteria, and other infections. So today I'm going to focus on air pollution, wildfires, as well as heat stress, and just pointing out to everyone, of course, we've had fires for a very long time on our planet, and those are important, and we can call them what we say beneficial fires for clearing the land to some degree for forest management. But unfortunately, with climate change, we now have shown, i.e. the whole scientific community has shown that within those working in climate science and wildfires in particular, this graphic shows that the cumulative acres of forest fire area that's attributed to climate change events is about 50% more than what would be expected. And that's contributing to a lot of issues. By having increased wildfire smoke, you actually start to trap in more greenhouse gases, which start to trap in heat, which increases the temperature around the globe, which then melts the snow even faster, leading to drier forests. And this is a positive feedback loop, unfortunately, that adds to the ability of the forest to then become kindling for even more severe temperatures and severe storms that are in and of themselves needing to be regulated to help prevent the human health risks. And I want to talk about those human health risks, not just by the fires alone, but also from the wildfire smoke. This is a graph that was published by my colleague George Thurston from New York City. This is in real time from this past summer. To be able to collect the data this fast is really commendable. But you can see here on the x-axis, the months over time in 2023, and in the y-axis, the daily asthma or COPD, chronic obstructive pulmonary disease, visit count. And this was assessed looking at the emergency room visits here. So as you move along in this, you would expect to have some increase in emergency room visits because that's when the pollen counts also increased. And we'll talk about pollen counts if you'd like at the question and answer session, that those are also increasing due to global climate change. But importantly, here's the wildfire days. That increase in what we call on the y-axis here in panel B, PM 2.5. So that's particulate matter that's less than 2.5 microns. And why we study that, most importantly, and a lot of that work was done initially for the Clean Air Act and in our Department of Environmental Health at Harvard School of Public Health. But in that PM 2.5, it's a nice measure of how bad the pollution is, literally. And this was over 150. And with that, you can see within those small amount of days, the increase in asthma visits to the emergency room. So these are highly attributable. These associations have been seen not only in the wildfire smoke in New York City. We are measuring this in Boston as well for this past summer. But importantly, as one might ask, well, how long after the wildfire smoke, how long do you have to be exposed to before you start seeing these asthma increases? It's about 0 to 4 to 5 days. On average, 4 to 5 days of constant exposure will increase the rates of asthma in certain age groups, especially children. There's a 20% increase in stroke for those that are over 65 years of age, as well as a 40% increase in heart attack. And these are averages. These have been shown from not only the New York City data here, but also data across the world. And unfortunately, a lot of wildfires aren't wild anymore. Some of them are man-made. And so this data has been collected over the length of time over the past 10 years, approximately, for many different countries that have been exposed to wildfires. And unfortunately, with wildfires, the smoke is from not just biomass or trees, but also from commercial and residential homes. So when we think about commercial buildings that go up in fire, residential homes that can go up in fire, we think about our upholstery going up in flames, paint thinners in our garage, detergent that can go up in the air. These are all compounds that, when degraded, can be toxic. So these are long organic names of chemicals, but importantly, one should be careful about how to measure these and how to make sure that we monitor them over time. Wildfire smoke isn't really wild anymore. About 50% of it in the western part of our country is made up of commercial buildings as well as residential homes. And so you see a lot of other products, microplastics, dioxins, vinyl polymers also within this. We can actually capture the smoke and run it through some very highly sophisticated equipment from a biochemical standpoint. So that's why we know what is in your typical wildfire now. And then I also want to point out that those people that are exposed directly are the firefighters. And you can see here, not everyone wears a mask. And unfortunately, we're also studying to what degree wildfire smoke affects health in those that are directly exposed to it, but then also those that are hundreds of miles away. And so looking at the mechanics of how wildfire smoke affects our health, for those of you who unfortunately were exposed this summer, perhaps outside, and felt a little tickling in your throat or a little congestion or cough, some people feel that, some people don't. But like I showed you in the video at the beginning of this conference, it still gets into your body. So even though you might not feel it, it is sight unseen. It actually goes into your body and goes into the lower parts of your lung and gets picked up by the blood. And when it gets picked up by the blood, and all wildfire smoke will, because of all the chemicals that are in the wildfire smoke, they can directly cross into the blood and cross from the blood into our brain, into our other parts of our body. And what I look at is how that smoke affects the immune cells, because the immune cells are so important, as you know, with COVID, as you know, with other diseases. Our immune system protects us from infections, helps us keep healthy. And so my research in particular looks at immune markers. And there's a way to look at that when you look at the blood. And within my research, I really espouse and want to frame the work that I do now at Harvard with the principles of what the Salata is about and what Professor Stock mentioned today, which is that we want to focus on solutions. We know that climate change poses a threat. We know that it's a threat to humans and a threat to our planet and a threat to our health. But importantly, how do we make sure that we can focus on solutions? And in that solutions-based framework, focus on education, research, and really, when we think about solutions, make sure that they have science as a basis towards moving those forward and testing them. And one of the frameworks that we do in my lab is to look at solutions-based research that could impact policy. And so my colleague, Mary Johnson, is pictured here. We have a large program project grant from the National Institutes of Health, and we want to focus on solutions at the individual as well as the population level. I want to make sure as a physician that I can let patients know how are they going to do in the next wildfire smoke exposure, whether or not that's from Canada or whether or not that's from someplace nearby. I'd like to also be able to tell people on a population level what's best to do during a wildfire or during heat stress or another climate change event. So these are the types of solutions we want to be able to study to best help people on the individual and public level. But to do that, we really need to think about things. And that's why working with Salata is so important, because we need to approach this through a multidisciplinary lens where we think about policy and regulation, look about program, practice, and education, and how that might help us understand how to collect better data, do research, measuring what matters, quantify, and track. And what I do, especially in the field of environmental health and public health, is to measure, monitor, and manage. And that's kind of the framework that we like to put any of our policy framing research in mind. But in order to measure, we need to make sure that we know how to measure something and quantify it and be able to track it. And so that's what we've been doing in my lab. And the first part of my research when I started to focus on solutions was to focus on the Central Valley in California. Because the problem there is that within that bowl structure of California, there's a lot of pollution that kind of sits in the Central Valley. But let alone that, there's a lot of wildfire smoke that comes across into the valley from Yosemite. So it's in this position where there's an intersection of many highways. And what you see here is a roadmap of the highways that come through a place called Fresno, California, which is one of the most highly polluted cities in the country, unfortunately, has much higher PM 2.5 or pollution than other cities in the US. And you can see here, each of those circles is actually a family, and we were able to geospatially map their pollution exposures. In this case, it was a specific organic compound that we were measuring in the exposure units that the EPA uses on the rooftops of the Fresno buildings. Well, why we studied Fresno? What linked me to Fresno? Well, I was seeing patients up in my clinic up in the Bay Area, and I was noticing that people from Fresno had an increased asthma rate. And then I looked at the epidemiology, and the asthma rate in Fresno, California is between 20 to 30%, which is much higher than the national average. I also, as an allergist, was getting told by my patients from Fresno that all of them pretty much had allergies. And when I looked at the data, 70 to 80% had allergies compared to the national average, which is about 30%. So again, that really told me there was an issue here that we need to think about. So I started to work with the NIH, received funding from a grant, collected much data from these individuals in Fresno, and I've been doing it since 2009, thanks to a lot of great collaborators. We collect all of these exposures that are in this slide, and then we do it over time. And now we've been looking at these critical issues that our solutions facing. But first, we need to be able to measure something to be able to think about how solutions are helping individuals. So what we did here was to look at immune markers that are markers of inflammation that can lead to disease. You're seeing here controls that were relatively low exposure of pollution compared to those that are high levels of exposures here. Many of the community are Hispanic, so we had high levels of Hispanic as well as African American and white individuals. So how do we measure these immune markers? Well, there's actually a really great machine that can look at least 42 markers at once. And why is that important? Because our immune system is complex. Many of you who read during the time of COVID, many cells were important in fighting infections. There's also many cells that are important for balancing our immune system so that we don't get cancer, so that we don't get allergies or asthma, so that we don't get autoimmune disease. So to me, this is such a great framework of understanding how exposures might affect the human body and how they affect the human body in the acute as well as the chronic level. So let me just take you through this. This is a really great machine. It's called a cytometer. That's a time of flight mass spectroscopy. The most important thing to know is that this tool allows us to break apart and look at many cells at once, 47 different cells. And why is that important? We just don't want to do research or count cells for the sake of counting them, but we want to make sure that it's actually going to help us understand how exposures affect the immune system. So here, for example, in the control group versus the exposure group, we have an increase in some of these, what we call inflammatory markers. For any of you who've gotten tests from the lab in a medical doctor's office, you might recognize that this is something called CRP, which is a reflection of inflammation. We also looked at other markers of inflammation, but that's what we found in the plasma. What we can do with that special machine I talked about is you can actually look at each cell in the human body, and they're all here in little dots. This is kind of a roadmap of each human immune cell. And why is that interesting? Because we can actually dive even deeper into the functions of those cells. So we can get levels of functions like what receptors are working on them, what receptors are turned on during pollution, what receptors are turned off during solutions to pollution, for example, or to climate change. So with that in mind, we have been the first lab ever to be able to go back in time, because everyone wants to know, when was I exposed? How chronic was that exposure for? If a solution takes place in my community, or if I start wearing a mask, will I start seeing reversal of that exposure? So we've been able to map, in this regard, heavy metals, for example, that also are found in wildfire smoke. So I'm going to just take you through this with our understanding of science. We can now track different heavy metals in cells. Why is this important? Because smoke, because water pollution during climate change, we are going to see a lot of flooding. We're going to see wildfire smoke. We need to understand to what degree we are getting exposed to things that could both acutely and chronically affect us. And in that knowledge of measuring, we also need to then look at a framework over time and be able to measure over time to see if a solution were to put into place, either at the individual or public level, whether or not these would reverse. So that's why this exquisite ability to know how these heavy metals affect our cells is important, because it's going to be a biomonitoring system, basically, just like you might have monitored how well you responded to a COVID vaccine. In the same way, we're going to be able to measure how well we responded to a given solution. So here we have mercury, or it's seen as Hg. There's different forms of mercury that we can actually track in someone's cells. So the control group is blue, the exposed group is orange. And what we do is you can actually fine tune and look at each cell and how much mercury they have in them. And why is that important? Because some cells last for days, some cells last for years. And we now are able to go back into these cells from our framework of using this special machine to look at the dose of a given exposure to heavy metal like mercury, look at the cumulative dose, and look at what time, what place in time that person was actually exposed to. Because you could go back and date when that cell started to live based on something called telomeres. So again, this is really great information to have, but it's coming to you. These are things that are now in the laboratory phase of research, but it's important to know that a lot of these techniques are becoming available more in the clinic. So now I want to focus more on solutions as well. So when we think about wildfire smoke, I want to be able to give you a framework for how we can focus on these solutions. So this is a wildfire where there was no treatment. Here's where a beneficial fire was used, whereas here's with thinning only. And you can see the forest here in Oregon. The best outcome for this forest in particular was that had prescribed fire. So in the same communities in Fresno, we were able to actually clock when prescribed burns were exposed to the community versus wildfires. And our policymakers had a lot of reticence towards using prescribed burns or beneficial fire, we call them, towards improving forest management and reducing the likelihood of wildfires. So we were able to show at the first group ever to be able to show that prescribed burns were less toxic to humans than wildfires. And that makes sense because people are allowed to leave their homes beforehand. They're told that a prescribed burn is coming to happen in their community. Prescribed burns emit a lot less smoke, but no one had actually calculated that or measured it. So we did that here in this paper, and we showed that wildfires increase these air pollutants molecule. You can see here PM2.5, but importantly, they also decrease inflammation. So we also tracked the blood of these individuals that were exposed to prescribed burn versus wildfire smoke. So that led to policy change, which we were really humbly happy to be part of. That our work then was used by the EPA and enabled the Biden-Harris administration's Wildfire Commission that I was part of to be able to think about using prescribed burns or beneficial fires as part of that mitigation management plan for climate change. So that was a great part of our research to be able to see that it got taken into policy, but also we don't want to stop there. We need to do more. We need to do more research and quantify solutions. So when we think about some of the solutions for adapting to wildfires, we oftentimes ask people to relocate, but that's not so easy. Close doors and windows, that's not easy either if you're going through a heat event. Stay indoors, but that's not easy for people that work outdoors, and wear a face mask. And for those of you interested, there have been studies on what type of face mask to wear. It is not the one that this person is wearing in the picture. Those just let in all the particulate matters completely. And so you think about how we can best protect our families, protect ourselves against some of the issues that air pollution can cause in terms of our health, and that includes wildfire smoke. We need to look at this in its entirety as to how to improve and to mitigate against and adapt to climate change events like wildfire smoke. So I just want to tell you these little snippets, and hopefully this will also help you or your families. But an N95 mask has been shown, and this is a publication from GeoHealth and another publication from Physics Today, that an N95 mask, again, same mask that you used in COVID, is the best to be able to prevent pollution-induced exposure from wildfire smoke or air pollution in general. It's not perfect. You could still let in some of those gas compounds, but it's the best we've had. Bandanas and surgical masks do not work very well, as you can see here in these graphics. Now, many people ask me, what filter should I use for my home? If you have central air, use a MERV 13 filter. That really reduces pollens, other gases, as well as particulate matter. But you need to change it out every 6 months because unfortunately those particles get in the air, and we do have air pollution, even here in the US, where you'd think that it would be less, but we have enough air pollution. We need to change those out. There have been a lot of studies now, thankfully, on HEPA filters and on these types of exchanges. So in terms of the surface area of your home, as well as the physics of the filters, know that you pretty oftentimes need about 3 different filters in your home to be able to reduce the pollution amounts from what we would call in the green zone of air quality indices of 40 down to lower than 10. That's where you want to be in terms of the World Health Organization recommendations. And I just show you some of that data where you can see a reduction in a lot of the pulmonary function in people that have used filters, as well as a reduction in asthma rates. So a lot of the work here I'm showing you is wonderful because we have solutions that now have been metriced. I also want to comment on the information that is here shown in this slide. The Salata Institute has done some great work helping fund some of the alert systems around our world. We have crisis ready here pictured here because as we think about mitigating and adapting to climate change, we need to think about how well we can alert communities. And this is one that's working with Dr. Balsari and Dr. Bucky on mobilizing and accessing data to satellite data to be able to help communities. We're doing a lot more around the world for cooling sidewalks. We're looking at cooling processes. And in that, I wanted to just close with some other really great things that we're trying to do and moving forward with groups at Salata. When we worked in Fresno, we did a lot of work on diesel buses and trying to change them over to ultra low sulfur diesel as well as to electric buses. We worked with the local communities there, did policy, showed them our data with some of our work and information. And that enabled a lot of the governor's office groups as well as other communities to be able to push for switching out from diesel to electric buses. So many people ask me, how well is that characterized and how much money are we saving by potentially switching out a diesel bus to electric bus? And so we've done some studies now, and this is very preliminary, but I wanted to share it with this audience because I think as we think about what is available and the EPA now having a new clean school bus program to try to switch out diesel to electric buses, we've been monitoring that and modeling and using some benefit cost analyses at the School of Public Health. And as you think about these models of school buses being switched out, in 2010, there was a switch to a high diesel to a low sulfur diesel type fuel. And so that's why you see this reduction in PM 2.5. But we wanted to go even further and look at what are the cost benefit analyses of switching out school buses to electric buses. And so we've been monitoring that across the country. My colleagues, Dr. Robinson and Dr. Chernani at the School of Public Health have now looked at that cost benefit, and it's about $2,000 per bus per year, especially in metro areas. So again, there is a health benefit, and that could be quantified. And we're really grateful that we're working with the Biden administration now that over time, for both the health and the climate benefit, looking at benefit cost analysis, it's about $120,000 per the lifetime of that bus. Finally, there is about $6 plus in co-benefits in health for every dollar spent in reducing greenhouse gases. That's great to know. There's a lot of solutions facing research in heat stress. And I'll just quickly show you that with all the data that we're collecting across the world, thanks to my colleagues that have been studying green spaces, as you increase green space, you can actually decrease the relative risk of heat-related illnesses. This is a great study that was published this past year in Lancet, which is a high-impact journal. And overall, what was done is looking at different cities across Europe. And if you increase tree canopy by 30%, you reduce heat-related illnesses by approximately 30%. So really good news for being able to use biodiversification and tree canopy. But we have a lot way to go. We have a lot more to do. And there are a lot of positive, which I list here. There are some negatives that we still need to make sure we can focus on. Like Jim was mentioning, we're clocking at about 2 to 2.5 degrees centigrade now if we don't do further reductions, but I'm optimistic that we can get there, but it's going to take a lot of political willpower and a lot of work to be able to do research on these solutions. So finally, with COP, Jim had mentioned that we're doing now a lot of work across Salata on engaging with COP, and in that, looking at the UN General and the UNFCCC. Harvard is represented now at many COPs, but this COP is for climate and health, specifically focusing on that area. And it will be run in Dubai in December. And in preparing for COP, there are some background information that you might want to learn about. But importantly, it is an annual conference that started in 1995. There are many people from Harvard that are going. We want to make a big impact in health and in climate change. And thanks to Salata, we're enabled to do that. We have many events that are occurring there. And we're working together with Salata and with Vanessa Carey, who's special envoy to the WHO on COP28 to make an impact. So I want to leave you with that and thank the Salata Institute for all their work at Harvard, for the research clusters and student hubs. And my thoughts are here in summary. We can measure what matters most, which is health. We can look at science-based solutions, look at multidisciplinary solutions-oriented research, and focus on education resilience and sharing our technology and information we're learning from iterations of testing different solutions for climate change. So thank you so much for your time today and your attention. I'll stop there.
Thanks so much, Kari. That was certainly quite a bit of information to try to digest. Let me just make one very quick point about COP28, which is that I believe there's around 20 or so faculty members or research staff from Harvard going there. And then there's an additional, I think, dozen or 15 students. Many of these are being supported, the students especially are being supported by the Salata Institute, and they're going over there for, in the context of various engagements that they're doing. This is I have so many questions I could ask. Let me just encourage the audience to drop their questions into the Q&A, and then I would love to be able to turn to those, and I will turn to those in just a minute. One of the questions was about communication, and I have to say, so I was in Boston this summer, and we had the air pollution coming down from Canada, and I have to say, the amount of guidance that we seem to get about what you just gave all these things that we were supposed to be doing, like using HEPA filters and staying inside and so forth, and, N95s, but not surgical. And maybe I wasn't paying attention, but I sure don't remember that being a very clear message. Do you have some comments on those? Seem like, obviously, you want to not have the wildfire in the first place. Obviously, we want less emissions. But, here I am, and I look up and it's a red sun in the morning. How do we get this communication out?
It's fantastic because you can see we already have solutions in hand. We have individual and public solutions that have been tested. And so getting that data out, telling people to use it, when you think about the history of science, even when tuberculosis could be cured by sulfa drugs, it took 9 years for the average physician to be able to start to give sulfa drugs in a case of tuberculosis. We don't have that time anymore. So in that matter, Jim, I think that we really need to do better at educating. We need to make sure that we get this public health information quickly out so that healthcare providers know this and they can help their patients. In addition, we need to do better with local governments and national governments to say, here's your handout. So we've been working a lot with Sea Change at Harvard to be able to get those out there, but we can't go fast enough. And we don't have time like we might have in the 1940s when sulfa was discovered. We don't have time to do that anymore. So I agree with you. We need to do better at communicating and better at making sure that the media picks up on that, as well as healthcare professionals and other agents that can get this out there so that people know what to do and that they're given the tools to do it.
It seems to me that that's particularly important for thinking about what to do for some of the wildfires in the boreal forest. It's one thing to think that you can do some thinning or prescriptive burns in California or Oregon, where things are, they're vast areas of land, but it still is pretty compact compared to the boreal forest across all of Canada, where it's just hard to imagine you'd be able to do much of that proactive work. So we're just going to have to deal with it.
Yeah, this is really important. When you think of the proactive work, like you're saying, with the Biden administration Wildfire Commission that I was partaking in, there's a lot of forest management for prevention, for mitigating, for adapting the forest to better accommodate some of these conditions. But a lot of it's going to be aviation.
On this in particular, a question that just came in is whether it's possible to do predictions of where the wildfires will happen. And then I guess the related one is, it seemed to me really hard to know one day to the next whether or not Boston would be hit, or alternatively it'd be New York, or maybe it would be up in New Hampshire. So those predictions must be pretty tough too. Do you have a sense? I know that now I'm kind of talking about wildfire prediction
Yeah.
meteorology, not asthma and infectious.
It's fine. It's fine. This is again, when we think about the Salata and climate and sustainability, we need to be able to have this knowledge of different disciplines. So I only know what I know, which is that with modeling, now there are groups that are looking at features of forests and conditions in forest and drought, heat stress, as well as other conditions of the forest have either been managed or not well managed. And then they can predict if there were fuel to be put in that forest, to what degree would it catch on fire, and to what degree would that then be immersed in a more severe condition of wildfires. In addition, like you said, once the wildfire smoke is occurring and in the atmosphere, to what degree can you look at these horizontal and vertical plumes and then be able to predict how well they're going across? If you remember in Australia in 2019, they actually circumnavigated the whole world within 4 days. So people are getting better because we have knowledge now and we have data from satellites to be able to understand wind direction. And I think NOAA is doing some of this. Copernicus in Europe is doing this, but I don't think we're perfect yet. And we really have to help the global south as well in predicting the smoke. But even in the US, we weren't, some days would be Boston, some days would be DC. And that's also helpful for air traffic control. So there are a lot of consequences of being able to do better prediction. So thank you for that question.
A couple of questions had to do with particular impacts that might be more more salient for children or more impactful for children than for adults. Maybe you could talk about that either in the context, maybe in the context of the forest fire smoke, but you could opine more generally.
This is our work. I do focus on children and adults, but we've been focusing on children in Fresno, for example, since 2009. And I'm not the only air pollution worker that's focusing on children, because we are also acutely aware that for every child born now in the world, most likely, according to reports, that child will have and be exposed to at least one climate change related event in their lifetime. We also have to think about children cumulatively as we think about the compounding effects of climate change events, and then also other issues over a lifetime. So with that, on the good side though, when we can make changes like in LA, when they put more regulations for pollution control in diesel exhaust, literally people were able to show that within the 4-year time frame, that because children are developing their lungs and because they have higher metabolism, they typically are getting more exposed to these chronic health conditions that induced asthma, for example, in them due to air pollution. So we actually do have data that air pollution can cause asthma. On the flip side, when you reduce air pollution, like what was done in LA, my colleagues at UCLA and USC actually studied that, and they were able to show that by reducing the pollution in the atmosphere, you could see an improvement in lung development and lung volumes in the children in LA. So to me, that's hope and promise, that if we can get better at measuring, monitoring, and managing and reducing air pollution, that those solutions will help, especially in children. But whoever asked that question, you're right, children are at a higher risk of some things. The elderly are at a higher risk for others. So we now are tracking data, but chronically lower pollution leads to improved health outcomes and improved abilities to accommodate. So if you have higher lung volumes, when you do get exposed to wildfire smoke, you'll be able to be more resilient so that you can not have so much compounding effect over your lifetime.
Maybe I could just ask a more scientific question that's a follow-up on that. You've been mainly focusing on wildfire smoke. You just mentioned diesel in LA. The study that you were looking at with electric buses was I guess that was ULSD, ultra low sulfur diesel, compared to
Yeah.
should I be thinking of these sort of fossil fuel pollutants? And then there was actually another excellent question, we can go into that later, about the exposures to a variety of different petrochemicals in the air in the
Yes.
in Cancer Alley and also in sort of around refineries and so forth in the Gulf Coast area. So should we be thinking about all of these as sort of the same? I mean, one PM 2.5 is just like any other PM 2.5. Are there important nuances between these different types of things in terms of their health impacts? These different types of uh, fundamentally, pollutants either from fossil fuels or from various combustion residuals.
Yeah, it's a great question. I mean, now a lot of aerosols are also in the air, and those are also pollutants. These are all toxic to the human body. If in terms of getting into the details, weighing more than another, there are different effects acutely and chronically, but PM 2.5 is what we can measure. Because we can measure it, we typically show that as an output measure. And with wildfire smoke, we can't so easily measure the microplastics in the air or the toluene content. So we measure PM 2.5, but it's a surrogate because if you know you have PM 2.5 in there, then you pretty much know that you probably have high amounts of lead, cadmium, and for example, and other volatile organic compounds. So it's a surrogate, but for wildfire smoke, unfortunately, it is more toxic in general than quote unquote diesel exhaust, but diesel exhaust is bad as well. These are all pollutants. They're all not good for the human body. So that's why we can track the PM 2.5, but there are other things that we just don't have the ability to track all that well. But you're right, all these things we use to be able to explain the health effects because that's what we've measured.
What about if we focus more on the specifically to the question that we had from from the audience about around refinery plants and petrochemical facilities in the Gulf Coast, Louisiana, and so forth.
So because when you see a PM 2.5 measurement, or when you go on your local websites and you look at Air Now, you get it in terms of units of air quality indices. Now, that's not all the same for every country either. Like the air quality indice unit in Germany is different from our air quality indice in the US. So I just want to make sure we're super careful. But when you get that, it really reflects 200 different toxins in the air. And it's related to PM 2.5 in particular because that's what we can measure. But typically when you have PM 2.5 in the air, you probably have about 200 other toxins, including what we call these chemicals that can be cancer inducing. And that's where, when we think about the Gulf, when we think about Cancer Alley, when we think about those areas where there's high concentrations of diesel, but also industry and potentially wildfire smoke, all of these things concatenate and build. And for any one person that's at risk for cancer, there's going to be a higher likelihood of them getting cancer. Now, we're looking at identical twins now, where one gets cancer from that type of pollution and the other one does not. And so we want to think about protection features and ways we can deal with solutions as it comes to not changing genetics, but changing behaviors or environment. But we now know, unfortunately, for example, Canada did a study that was reported 2 years ago showing that with communities that are exposed to more than 2 wildfire smoke events per year, they have a higher likelihood of brain cancer and lung cancer. So we do need to be super careful about monitoring. These are association epidemiological studies, but now we want to understand why and how that cause and effect relationship could occur over time.
Just from a study perspective, it seems like at least wildfires are sufficiently, sort of random that you can actually get pretty good case control designs, thinking about where the wind happened to be blowing this summer, but that's kind of a statistician's digression. We should probably stick to the rest of what we're doing here. Let's see. There was maybe I'll just pull in another question. One thing that was pretty interesting about your very preliminary, I get it, they're very preliminary results on the electric school buses. I was a little surprised, but I guess this is just the way it is. I was a little surprised that the benefits were only like $2,000 a bus per year, because I think of at least when I was a kid taking a school bus, you're standing there, the buses are on, you're just
Yeah.
like breathing this stuff in. And I would think I would be getting pretty high exposure levels. So
Absolutely. Yeah.
maybe my value of life isn't very high. So you're just but
I think value is very important here as we think about that, and I appreciate your question because we were extremely conservative. We're trying to just look at the health benefits compared to the cost of the buses, because right now your average electric bus costs between 200 to 300K, and a diesel bus costs about like 120K for a typical district. So we wanted to be really careful in making sure that we could contribute the costs of the actual bus. So you're right, that is a conservative estimate. It's taking in everything in terms of costs and only looking at the health benefit per bus per year.
so I might have misunderstood. Was that the net of the cost benefit analysis?
Yeah, that was the net.
Oh, I thought that was just the benefit.
Yeah.
That's the net of the cost benefit
Exactly.
analysis. So it's just straight cost beneficial, even though school buses right now are still electric school buses are super expensive, and they haven't really started coming down the cost curve.
That's right. That was the net.
So down the road, 3 years, 4 years from now, we'd expect them to be even more cost beneficial.
Absolutely.
I see. Okay, thanks for that clarification.
Yeah, exactly. When you just look at the health benefit alone, for example, we've studied that. And if you're a child with asthma and you're standing there at the school bus, and maybe that's just 20 minutes of standing outside and getting that exhaust, and you think the rest of the day you're not even getting exposed to that, perhaps.
Right.
That reduces your asthma, and there's a cost savings of about $20,000 per year per family who has a child with asthma. So that's not net. That's the health benefit cost, if that helps you.
There's another question about, and this is kind of a broad one, but it's an interesting one. In addition to the unique challenges that children face around climate, what solutions are especially promising for them, particularly as we think about heat and wildfires? So we talked a little bit about what general population might do, but what a little bit more about for the children.
That's great, and thank you so much. And when we think about children in infancy moving forward, what is going on around the world, a lot of people, some of these solutions are so local, which is great. A lot of these solutions to climate change mitigation adaptation are going to be hyper local because so much depends on the geography and the geopolitical issues. So when we think about children and focusing on that population, when we can benefit them by reducing urban heat islands, by increasing tree canopy. What's being studied in children now is not only does that tree canopy help with reducing heat-related illnesses, especially in children, because their metabolism high, they're more affected by heat, they don't have such a buffer system, especially infants, because they tend to have a lot more fat. So when we think about the solutions that are involved in climate change mitigation adaptation, not only are they important for all ages, but they have an even higher impact for children, longitudinally, but also in that one point in time. They can affect children dramatically with reducing their risk of heat-related illnesses. Also, with greening, greening has been shown to increase cognition in adults, but really increase cognition and even improved test-taking skills, for example, in children, elementary school children. That study was done in Australia. And then finally, by increasing biodiversity in children, they've noticed that even within 28 days, if they're more exposed to dirt and biodiversity in the playgrounds, for example, that they have in their schools, they have increased microbiota that improves their immune system. So all of us can have these benefits to their health when we think about climate change solutions, but to children, it has an even more compounding effect on their health over time. So to me, it's important to have all of these solutions available to all ages, but for children, it can really affect them dramatically in a good way.
That's fantastic. Maybe we should just switch a little bit here, and I'm interested in learning a little bit more about health, the Health Day in the context of the COP that's coming up, COP 28 that's coming up in Dubai. What are this is the first time, and I understand that you, some of our other colleagues at Harvard, and of course other health professionals around the world have been involved in standing this up. What are the goals of having this Health Day at COP?
It's an excellent question. COP is a place where many people are coming together, countries across the whole world, and a lot of the negotiations have already taken place pre facto. And so some of these items that we're going to be talking about, it's not so important because we can change the whole life curve of a negotiation day. But what we want to do is, thanks to Salata, thanks to being in the place where there is so much connectivity happening, the symposium of the World Health Organization, the UN, when people are coming together that way in COP, and it's thousands of people, what we're trying to do there via the Harvard group activities, thanks to Salata, that are going on, as well as with healthcare, is be at the table. So thanks to Vanessa Carey, because she's special envoy to the United Nations and she is out of Harvard, she's doing a lot of work with the World Bank, with different types of situations where we're looking at these benefit cost analysis to help policymakers understand that because this climate change is focusing on health, we need to measure health outcomes, both acutely and chronically, and be able to equate that to benefits that make sense for policymakers. So Vanessa is going to be looking at that with some of our group at COP. The other area that COP is going to be really involved in is looking at, like you mentioned in the very beginning, Jim, how do we get better information out to not only the US, not only to Boston, but also to the world? That when a country or a solution has been framed and we know that it works and then we know that we need to get it out there for information, how do we do better at that? So that'll be another whole area that the Harvard physicians and Harvard leaders move together with other climate change and health associated non-government organizations. They're going to have a whole symposium on that. We're also going to be talking about water insecurity and how that affects health. And then finally at COP, we have a bunch of students. And what I love about that focus, thanks to Salata for scholarships, we also intend to link in all the Harvard students as well as other students in intergenerational groups to ask them, what are your worries? How can we focus on that? What should we do to better help the next generation in understanding climate change and health issues?
That's terrific. That's very exciting. That's very, very positive looking after, positive and forward looking after some rather, depressing slides, I have to say. But I'm really delighted that we're having these activities and that you and your colleagues are taking these leadership roles. So I think that's probably a good point at which we're going to close this edition of Harvard Speaks on Climate Change. I'd like to thank the team at the Office of the Vice Provost for Advances in Learning for their production support, and the Harvard Alumni Association for their help with promotion and logistics. Thanks especially to Kari for giving us this fascinating discussion of the important work she is doing. This is a great example of how experts across all of Harvard are doing the pressing work of tackling and solving climate change challenges. Our next episode will feature Dustin Tingley, Professor of Government. Dustin will discuss the political, economic, and social challenges around the energy transition. His new book, Uncertain Futures, examines how communities that are critical to the energy transition can credibly be engaged and benefit from that transition. That episode will air on December 13th, and we hope that you will join us then. Finally, let me thank you, the audience, for joining us. Let me now turn it back to our VPAL colleagues.
Thank you, Kari and Jim. Thank you all for joining us tonight. We hope you'll join us for more signature events in the future. Information about upcoming events, as well as recordings of past ones, can be found at vpal.harvard.edu/vpal event.